Welcome, everybody, to the Board of Health meeting for June 23rd, 2020. Anybody here for citizens participation? Okay, having none, we're going to move on to tobacco violation hearings. Melissa, I don't know if you want to give an overview of the whole thing or if you want to go establishment by establishment. We have Marathon Mobile first. Then we have Lucky Farms, and then we have Shays Liquors. So if
We
you
can go by establishment. That's
okay,
fine.
all right. So why don't we talk about
Can you hear me?
Marathon Mobile?
Did you want me to? Or where's the person?
If you want, Melissa, if you want, you can just give them an overview of the inspection.
Oh, sure. That one. I had a teen go in and ask for a pack of cigarettes on Saturday, March 7th. And he was asked for ID, but he obviously didn't have the, and they still gave him the pack of Marlboro cigarettes. It went out.
Okay. My understanding from reading this, and of course, please correct me if I'm wrong, you had noted under the comments that the employee scanned his own ID for an ID identification.
Yes, that's what the teen told me when he came out, that scanned his own ID.
Okay. All right, I would also first like to say that I apologize to the tobacco vendors. I know that you are in violation, but with everything going on, we wanted to have you in person, but because of not being able to be open to the public, this is what we thought was appropriate. So who is on the line to talk for Marathon Mobile?
Your microphone.
Are they
I was
unmuted?
just going to say,
He's muted.
I'm looking up. I apologize. Hi, how are you, Harmon? Can you How do I unmute him, guys? Here.
Are there audio only or a video also?
Do you hold on? Do you have audio?
Where does he?
Right, his audio.
He has to unmute himself.
Okay.
At the bottom of the screen.
Okay, can you unmute yourself at the bottom of the screen? Yep. Yeah, I can't. All right. Yeah, we can't hear you.
Diane,
Yep,
Diane, if are you able to unmute him?
I cannot,
If you
unfortunately.
point to his name, it says
I
that you
cannot.
can't.
It does not allow me. It does not allow me to. Well, hopefully he's reviewing on his end. Maybe he can speak in a minute. But my concern when I read over the inspection report from Melissa is that the attendant
Who
at
is
the
on
gas
that, ma'am?
station.
Is that Mahmoud?
Go ahead, KJ.
Is that Mahmoud?
Yeah.
Yeah, Mahmoud.
His video is on.
Yeah.
Yep. His audio is not on.
Yeah, ask him. I think somebody's trying to help him out, I guess.
Mahmoud, somewhere on your screen there should be a picture of a microphone, and it'll be red with a line through it. If you click on that, that will turn your microphone on. Or tap on that.
Just
There was also an icon in the address bar that I had a problem with on the search bar at the top. There was a little icon, and I had to click on it to. It was blocking my microphone.
if you go down to the bottom, I think something will pop up with meeting and microphone as well as phone and then a video there. If you go Take your cursor down all the way bottom.
Yes, sir, my voice is coming.
There you go.
There you go.
Oh, there you go.
Yay!
We got you.
Hey,
All right, you're on. Okay. So I don't know if you heard when we were going over the inspection report from March 7th. And your attendant at the gas station actually scanned their own ID for the sale of tobacco products to a minor. Can you hear me okay?
Yes, I hear you. Okay.
So can you just let the board know what has happened since that compliance check and what you have done to rectify the problem?
Yeah, actually, after the coronavirus problem, my regular guys, all three guys, he is working in my store. And then after these guys, he sold tobacco to the minor. I have all IDs we check in the scanner. He showed up all expired ID or the underage ID. But this guy, the student, he's working on Saturday, only one day with me. So this guy, he asked for ID to the customer, but he don't have the ID. I don't know why he scanned his ID, because in my training set, I asked him, we don't have to sell any kind of tobacco product to anybody has no ID, because in the scanner, customer has to scan his ID. And in my register, there is 0% chance, because in all states, ID we scan in the register. See, he showed up all the expired ID or underage ID. So this guy, he made a mistake. He put his ID on registers. So then after I fired this guy because he's not my regular guy. So then after you guys can check anytime if you guys send anybody, any minor, any expired ID. So my guys always check IDs properly. And I have two guys, they are my proper employee. One is working East Bridgewater for many, many years. So he is working in the morning shift. And the another guy, he is working on gas station almost 5 years. So these are two already trained and good guys. So no chance for mistake. And I have the second ID check machine, yellow machine on the counter. Sometimes his ID is not properly scanned in the registers. So the second machine, we just put on it and just scan ID. So all IDs is showed up, the expired ID. So we have two IDs, ID checkers in my gas station. So this guy, he make a mistake by himself. He put his ID. He think about that. He's okay, and he don't have the ID. And sometimes people come in and they don't have wallet in the pocket. And he tell me too many arguments. But the violation is done over there. And so I try my best. But I have all experienced and good guys. He properly check ID. Last month, I spent too much time in the stores because I have a problem. No employees is working with us after the COVID problems. And still, I have to look after by myself everything. But these guys are checking ID for all customers, and he make a 0% chance for mistake. He put in two scanners I have, one in the register and one machine is over there. He checked all IDs. So this is the only mistake he made it. He is a young kid. He is a student. He is available for work on Saturdays. So he make a mistake.
Right. Okay, does any of the board members have any questions, or Melissa or Mark?
What's the previous record in terms of the violation? Do you know? Does somebody have a
violation under this ownership?
In my ownership, this is first violation, I think, and I make a 0% mistake chance. You have two scanner, one in the scanner and one separate machine over there. but somebody is, employees always, he make a mistakes and he make a decision by himself. But strictly, I ask to everybody, you should have to check IDs. But in my gas station, there's not too much, tobacco products. Only cigarettes we are selling
It
over
does.
there. My focus in the gas business, so I'm not pushing anybody. I want to sell more cigarettes or more tobacco products or too many things. I don't have a tobacco product in my store. But
This
regular customer, he need cigarettes, so that's why.
when you hired this guy, did you train him or give him the tobacco guidelines that we have, or
Yes, these guys is my permanent employees. Both of them working over there. One is working 5 years and one is working more than 5 years, and these are all trained. And nobody sells cigarette without he check ID on the yellow machine. The yellow machine is showed up all the expired IDs, all the underage IDs, and scanner is already showed up. But
So
they are checking in both machines, both
Mama, the
scanners.
question was whether this student who you hired, did he get the training?
This student actually, I asked him everything, each and everything. Strictly, I asked him what you have to do for the tobacco sale. He is working only 2 weeks, and then after he make a mistake, I fired him because I don't want the irresponsible guys. They are not responsible.
Well, just so you know,
big mistake.
Just so you know, in the past, the board, we've had different board members, but the board in general doesn't recommending, letting employees go. Retraining an employee usually takes care of the problem. But what KG was asking you is, you probably trained him when he got there, but it was pretty significant that he scanned his own ID versus not doing the sale. So
yeah, I trained him, but he make his wrong decision to make sale for tobacco. I strictly ask everybody, we don't have to sell. I'm not focusing on the tobacco sale business in the gas station. I'm focusing on my gas business.
Well, I know you got a variance and you're next to a school.
Always make a mistake, and he argue too many things. I ask him, you don't have to sell. If people have no ID, underage, or whatever, they have expired ID, we cannot sell tobacco. Okay. So I, trained to all my guys strictly. I ask each and
my understanding, Mark, I believe the fine's been already paid, so we're all set with that part of it.
Okay.
Mark Warren?
Yes, Diane, I'm sorry, having trouble with the mute button. That is correct. And the question to Mahmood, if he can hear me. Mahmood, it's Mark with the Board of Health, the Health Agent Director. Mahmood, can your scanner be programmed with the personnel in your place, their IDs, and then programmed so that it will not accept their IDs?
Yes, sir. If any, underage ID, so he showed up invalid ID. And any expired ID showed up expired ID. It clearly, if I am behind the counter, somebody gave me ID, we scan in the register. If this is expired ID or invalid ID, it showed up. And we have the yellow machine. This is ID checker machine. I have in my all gas stations. So people can check easily, 0% mistake chance over there.
I understand what Mark is saying, that if there is an employee who's going to scan his own ID, the machine should say a negative result for that scanning. Is that right, Mark?
Actually,
that is correct, KG. That is correct.
Maybe, Mark, I'm just thinking it might be a discussion that maybe you should have and just follow up with us, maybe, if you don't mind. There might be just a, sometimes this venue is not the easiest to communicate, so I apologize for that, but.
That's fine.
All right, is there any other questions for Marathon Mobile? If not, we will move on to the next establishment.
If I can
Go
add
ahead,
one
Chris.
thing, and this would apply to Marathon Mobile and any of the other tobacco vendors who happen to be online right now. When and if, and we hope it never happens, but in the situation where an employee makes a mistake, and we get that that can happen sometimes, as Diane said, retraining it's a great opportunity to not just retrain that employee, but to retrain your entire staff. That's the time when you have the conversation with all of your employees and say, look, this is what happened and it shouldn't have happened. And here's how we do better.
Sure, sir. Sure. Right.
Mhm.
Right.
Any other questions from the board members?
None.
Okay, you're welcome to stay on the meeting, but we are going to move to the next tobacco establishment, and that's Shay's Liquors. Who's here on the call? I apologize. I'm trying to scan through the.
Hey,
Mr.
Dan,
Patel, how
it's
are you?
Jay. Good, how are you?
Good, thank you.
Let me see if I can put my video on.
You put your microphone off, Mr. Mohammed.
I don't know if I can do that either.
You can do that. You should be able to do it. Yeah, of course.
Okay. Can you guys all see me?
Yep.
Okay. Right. So, so we also have, you know, we're in violation on Saturday around 1:30. The employee that actually was doing that was a fairly new employee. Unfortunately, you know, forgot to ID completely, and you know, it would happen. Actually, I know I was running late that day, and his shift ended at 1, and I usually come and cover. But unfortunately, it did happen. Since then, we actually have done 2 different training exercises within our shop to make sure that all the employees are well aware. We do actually quite a few just because we are a liquor store. At the same time, unfortunately, due to COVID, that employee is also no longer with us, the one that created the violation. Other things that, you know, we've been doing, I mean, I have this new tendency that our system has allowed us to our POS system allows us to now no longer run a transaction without having like a message that pops up that says, hey, you need to verify ID before the sale is completed. So that's something that we've added on. It's been a feature. That's something else we've done. We do have an in-person training that's scheduled, but it's been pushed back due to COVID. And that's unfortunately, those are the things that we've done in order to prevent this happening again. Obviously, the reduction in tobacco products is definitely a huge, and you know, I don't want to say a huge help, but it's, you know, something that will also help mitigate more future issues, I think. But any questions that I can answer?
Yep, I was going to say, any other board members have any questions? And again, as far as I'm aware, your violation notice, excuse me, your non-criminal violation has also been paid. So we're all set with that as well.
I'm impressed with the steps that have been taken.
I'm sorry?
I'm impressed with the steps that he's taken.
I was going to comment on that because you went to the next step also, and I think that says a lot. I mean, you being a liquor store as well, like you said, you know, have to be careful on multiple different levels, but it's good that you have it prompt them and ask that. And I'm sure I can speak for the board. We appreciate that.
Right.
Yeah, we almost do like 5 to 6 in-house trainings, and just because, and then there's people that are strictly that don't ever run register, and then the people that do obviously get intensive training. But I don't know if it was an off day. It could have been. He was a newer employee at the time. He came on do a seasonal help, and then still stayed on.
Okay, is everybody still there?
Wow.
That was weird.
Yeah. So KG, I'm not too sure what happened, but that was on your end. Came up, oh, okay. Sorry about that.
Yeah. So in any case, but I apologize on behalf of our company and the shop, and we're going to do our best to, you know, to training and making sure employees are aware of that it's absolutely necessary to ID for every single sale.
Well, thank you for your efforts. I appreciate it. And just a little note for everybody here is that, you know, even with, I know with the alcohol sales, that places get together and offer training collectively to help save costs. So in the future, I mean, if you know, we have a list of all the tobacco establishments. So if you're doing a training and you're looking to invite other people, we can let you know, and maybe it could be a collaborative effort, because I think everybody's probably on the same mission for not selling to minors. So I appreciate it.
Right.
And again, you're more than welcome to stay on the meeting as well. We're going to move on to the next tobacco establishment. If everybody's all set with Shays Liquors.
Thank you.
Next is Lucky Farms. Is anybody on for Lucky Farms?
He muted himself. Chetak.
That's good.
He has to unmute himself.
No, we're all set with Shays Liquors. Now we're on to Lucky Farms.
Yeah.
But I don't see anybody here. Okay. All right, Melissa, if you don't mind, just again, the same thing. I think it's pretty obvious about the inspection. I don't see anybody here.
Were they told to be here?
Yeah, Diana, I'll try sending him an email and see if he responds.
Okay. We can, if you want, we can table this one just because I don't see, again, just looking down the list, I don't see.
I see Piyush Patel.
Yep,
I don't know.
hold on.
There he is.
Yep.
He needs to unmute himself, isn't it, Piyush?
Yep. Mr. Patel for Lucky Farms, you'd need to mute yourself. Unmute yourself. It's going to be a long meeting. And it's not you. We're telling everybody at the bottom of the screen, you should have a microphone with a slash through it. You just have to click on that. Just for the record, next time we're waiting for an open Zoom.
Hello.
Hey, Mr. Patel, how are you?
All right.
Good. I don't know if you've been on the call, but what we're asking everybody to do is just give an overview of what happened for the tobacco violation on March 7th.
Yep. One of my longtime employee, she's been with me like almost 15 to 20 years now. And she only works weekends. She was on and she did ask for an ID, but the person didn't have it and she still sold it. I don't know what the conversation happened. She didn't remember. I talked to her.
Okay.
She didn't recall the transaction afterwards.
Yeah, and I apologize. I know it's been some time to refresh everybody's memory, but can you tell us what you've done since? Have you done retraining? Have you changed anything on your register?
My POS doesn't allow the ID thing, what Chase was talking about.
Okay.
I've looked into a different software, maybe upgrade the software or something, maybe. As far as training, all my employees have been trained for checking ID for the alcohol and cigarettes.
Okay.
It's one of those things that she knew she messed up and she didn't have any except to say sorry. She didn't know what else to say.
Okay.
Like I felt comfortable selling it to him. That's why I sold it to him, thinking he was older.
Right. So
recalled-
is your policy now to card everybody?
Yeah, it's always been that way, but
Okay.
for whatever reason, she did ask for it. The guy didn't present it,
Okay.
but still sold it. So
Okay.
I don't know what else to say.
All right. Anybody have any questions? Again, my understanding, the violation notice has been paid. So he is all set in that aspect. Any of the board members have any questions? No?
Yeah.
What is the fee that is paid?
$100, right?
100 or 150, something like that.
300.
Oh,
For the first violation?
yes.
Yeah, we raised them.
Whoa.
So it's probably safe to say that with a $300 violation, that it's probably not going to happen again.
I hope not. I've been in business 22 years. This is the first time for cigarettes, so let's hope never again.
So we'll just say it won't happen again, right?
I think part of the problem here, to the vendors, to the cigarette retailers, we do understand the challenges you face. You can't be watching every employee every minute of the day, and there are some that are going to be renegades, and there are some that are going to make honest mistakes. So, like I said before, this is an excellent opportunity for retraining, and I think that the best part of this, I think the vendors know above everything, to have to pay $300 out. That's a lot of packs of cigarettes to make up that $300.
Yes.
So, and that's part of the reason why the fine is that, so that there is a significant impact to provide incentive for it to not happen another time. So I appreciate everyone, Mr. Patel and everybody else that spoke on behalf of their stores. So we just hope that, the first time we're pretty easy on you. If you come back though for a second time, we're a lot tougher and a lot less nice.
Let's hope we don't have to.
Yeah, we hope so too.
Yeah.
All right, if everybody's all set, we're going to move along. And again, the establishments we just spoke to, you're more than welcome to stay and listen to our meeting. Melissa as well, if you want to stay on, you're welcome to. I don't think, I'm just getting organized. We are going to move along to COVID-19 updates. Ed, do you want to start?
Sure. Hi, everyone. So I sent out the statistics on Monday. Our website's been updated. Good news, we've had no new cases of confirmed cases. We did get one this afternoon, but after we started working on it, we realized he didn't live in Ashland. So we're transferring that case down the Cape. He gave an old address somehow on his lab slip. So we're going to transfer that down to the Cape tomorrow morning. We are getting, though, some probable cases. So when we get the new cases through the Maven system, they come either as confirmed or probable. What the probable ones are people that have gone for serum testing to see if they have antibodies. Unfortunately, some of the doctor's offices are still making a mistake and are not sending, when they send their patient, they're not sending them for both a serum and a PCR test, which is a swab. So when we get that probable test, we have to then send that person back for a PCR test to see if they're actually at this moment in time infectious. That seems to be a challenge because some people get a little annoyed that now we're sending them back for another test, but that's our only way to know if they don't have the current COVID-19 currently. But again, our numbers look really good. Again, the nursing homes have been in great communication with us. I still check in a couple of times a week with Waterview Lodge. Their communication has been phenomenal since we've had our meetings with them. And we're clearing more. So, and you'll see that our numbers are really up there with the cleared cases now. Again, do we anticipate maybe a little bit of an influx? Possibly. They reported today that they are seeing a 2.5% positive cases for people that did attend some of the rallies in Boston. So And those numbers are just starting to come out now, which is about right around that 14-day mark. So again, we'll have to wait to see what the next few days presents to us. On another note, just for the board, for everyone to know something, I'm also on the board of directors for the Metropolitan Boston EMS Council. I represent law enforcement for Region 4, which is pretty much the 40 cities and towns around the Boston area. And I brought up an issue at our last Friday's meeting, and I've been selected to be on a small subcommittee to look at what is the mass vaccination program going to look like once a vaccine is released. And also, I have already started working on plans for Ashland, what it might look like, because it's going to look completely different than H1N1, because we have to account for the social distancing here and the potential, and to protect our first line workers that will be helping us with the vaccine. I do want to give a little kudos to Laura. I have Laura working on a project for us. She is seeking out companies that may offer us the ability for people to sign up for a vaccine online, schedule them, do all the questions ahead of time, just trying to pre-plan and kind of come up with what this might look like. Also, I'm coming up with an equipment list, what we are going to need as a town in the event we have to do a mass vaccination program. I'll be honest, I'm anticipating from the talks I've been listening to that, if we're a town of approximately 17,000 people, then we may be responsible for vaccinating between 7,000 and 10,000 people. Sorry, and that's not even once, because they are anticipating the first vaccine will require 2 doses, the first dose and then another one 30 days after that. Again, I'm just kind of working on all the particulars, and as I keep coming up with stuff, I'll just keep presenting that to the board, what that might look like. I do want to just mention too, when Mike Herbert and Jen created this COVID task force, we never really knew what it would look like. But I want to tell you about something that happened today, which just shows that pulling this all together. We had a gentleman, a young man, probably late 20s, early 30s, showed up at town hall crying. So obviously someone went out and tried to figure out what was wrong. And we learned that his mom passed away from COVID, lived in Ashland. We have not received the death certificate yet. But we also found out he was homeless, living in her apartment temporarily, taking care of her dog. Didn't know what to do. He has to be out of the apartment by the end of the month. No food, no money. So I got Jennifer Wolfing involved right away, and we met with this gentleman outside at the picnic table. And within a short period of time, we met with the people that run the apartment, and they're going to allow him to stay in there till Friday. Jen Wolfing is helping him find a shelter. We found a foster home for the dog, and we found a neighbor that was willing to take the birds. And Jen Wolfing is going to continue working with him and is also helping him get connected with Mattereese Funeral Home for his mom. Again, just because of this whole committee, this is just one of the things that is happening in the background that nobody even knows about. And that's kind of my report.
All right, thank you. Jen, do you have anything you want to add?
No, I think that really covered it. I mean, we're continuing to work through the phases of the opening. So, as you know, we're in phase 2 and 2B or 2.2. So now restaurants can serve indoors, and personal services are starting to open up. So our team and task force and our planning department and Ed are working with those businesses to make sure that is being done safely. And so we'll continue to work through those as we get more information.
One thing I wanted to that caught my ear is when Ed mentioned about the vaccination, because I know we always talk about the Medical Reserve Corps, and in the future, I mean, that might be key. if we need all those people, because as we know,
Absolutely.
we're able to pull together people for this, but we might want to concentrate a little bit more on that in the very near future.
Yeah, I think I think that's a good point, Diane. So the reason why we pulled together a meeting really quickly before Audrey and the school nurses were out for the summer, because obviously they would play a big part, but it was certainly the first conversation of many. But we did talk about the medical reserve and what that could actually look like if we could, use this time, particularly if we stay in a sort of, knock on wood, a lull in terms of getting new cases, because obviously there'll be less time that's required for contact tracing, and we can start to plan really for the future, which would be great. And so Ed's really sort of started that process, but we're at the very beginning of that.
Right.
Hi, Diane, I have a question.
Sure, go ahead, Keiji.
Yeah. Ed, I know that you've been working on this. Do we have a statistics on how many people are being tested in Ashland?
KG, unfortunately, the state doesn't break down the testing by city and town. They only do it by the entire state. That's how the labs are reporting.
All of those things don't get recorded in the Marvin. It only goes if they have an issue.
Yeah, we only get positive. Well, let me correct myself. We only get positive cases in Maven, but if somebody has had a positive case and then they go for retesting and are negative, then yes, then we can see that negative result.
Oh, okay.
KG, that is something that the Mass Municipal Association and some of the mayors and town managers have been advocating for, just because it would be incredibly helpful for towns to know sort of what their rate of infection to testing would be. And so that is something we have not been able to get that from the state as of yet, but it's definitely been asked for, and I don't know if they're working on it, but I can certainly sort of revisit that.
Okay. The other question is, the gentleman that you met today afternoon to take care of him, is he capable of working somewhere, or he needs to be completely taken care of?
So I actually spoke to him. He actually just got a job at a restaurant in Worcester, and he's actually trying to find a friend that he might be able to stay with in Worcester now that he's gotten that job. But we're going to help him in the meantime. Jen Wolfing, and I do want to mention too, Jen Wolfing actually brought him some food today from the food pantry to get him through the end of the week.
Okay.
And I would like to also give kudos. I know in the past the board has had Mill Pond Rest Home in front of them multiple times for many violations, but I have to say that their correspondence I really appreciate, and I did respond to them today and let them know that we appreciate it. I don't know if it's weekly, but they're sending updates, and I just think it's a nice change for that establishment. So I want them to be publicly acknowledged for their efforts.
Yeah. Right. I second that. Big turnaround.
That's
absolutely.
Right. How are the other two establishments are doing, Ed?
Excellent. Constant communication with us. And Keith Roby, our fire chief, checks in with them every Thursday, along with all the group homes. And they're all in great shape right now with no cases.
So we should assume that if we don't hear from them, they're doing fine. And if we hear from them, there is some problem. Is that right?
And they've been quick to reach out to us to let us know right away.
All right. Okay.
Mark, do you have anything you want to add for the COVID-19?
Hello?
Hey, we can hear you.
Okay, yeah. No,
I had one more thing that I did speak to Ed before, or communicate with Ed before, regarding the beaches in Ashland. Apparently, currently they don't have any tests for the water for detecting any COVID-19 viruses. So I was suggesting that if they could do it, but he sent me some articles about how stable things are there within the system, and the virus may not be propagating. I know it doesn't do that in a salt water, but it's in fresh water there could be. But I've reached out to DCR to see what they do, if they do anything through Bill Moulton.
Okay. Mark, did you have something you wanted to add to the COVID-19?
And basically that we work as a team, and it's been a good experience because it took a team to get through to where we're at. I did offer to Jen and Ed at our meeting we had. It was I think it was a Zoom meeting. The past history of what I've been involved with mass inoculation since I was involved, and you too, Diane, you remember that, the 8-1 days back in 2009. So even though 11 years ago, you still don't forget some of the mistakes and some of the improvements. So with that said, I'm here to offer any advice I can offer from the past. And Diane, you could too, because you were a major part of that as well.
Right.
Somebody's got a lot of noise in the background.
They're working in the kitchen.
Yeah,
That's good. Hopefully-
Not
Okay.
mine. Not mine. Yeah.
Just thinking, getting my thoughts together. Well, I guess if I have any more to add, I guess we can just talk about it a little bit. Tom, did you want to add anything to the COVID-19?
Hi, everybody.
Later on, Tom, just so you know, later on in the meeting, I'm going to talk to the board. We can talk about it now if you want, but I'm going to ask the board to, I'm going to ask the board for a full discussion on Pizza Bella.
Okay.
And ask them to attend our next meeting.
That sounds like a good idea.
Excuse me as I lose my voice. So if there's anything you want to add for this, that's fine.
Nothing, just to echo what Mark and Ed have said, but also that we've been conducting verifications and documenting those on the Google Doc that Ed and Mark had set up for the outdoor seating. But now, as we know, new developments with the indoor seating is allowed. However, we've been doing verifications to make sure that there's availability of sanitizer, that the tables are properly spaced apart, and that folks are not exceeding the occupancy restrictions for that provision.
Tom, you just mentioned that you're updating Google Docs with all of your inspections. So
for COVID-19 specifically, right?
Yeah.
Okay.
COVID-19. So is that something that the board can access to look at what establishments have been visited and what happened upon that visit?
I didn't create the document. I think Ed might be able to chime in on that.
Yeah, I can share the document. Yeah.
Okay.
I can share that.
To date, as of like today, how many establishments have been visited for the COVID-19? And
I would say all of them, right? Mark, is that accurate, Mark? All of them have been visited.
That is all of them. Without, go ahead, Tom. Go ahead. Go on.
No, I believe all of them have been. All the people that expressed an interest in having outdoor seating have been visited. And if they haven't been visited, I've been in communication with them and had them submit pictures and other information to me via email that I tried to forward to the board prior to the meeting.
Yeah, in general, between the efforts between Mark, Ed, and Tom, the three of you have visited all the establishments here, food establishments here in town about COVID-19 in general.
In general,
right?
Diane, we can say for outdoor seating and retail, there are a few that come to mind that told us they're not doing anything but takeout, but we visited those as well, those restaurants. What we're waiting to hear is who's going to consider indoor seating. And that's slowly coming in. As we find out more, we'll go to them and
Did they need to notify you, Mark, that they're opening? Because it was today, right? Yesterday?
Out of courtesy, we would ask that they do. If they don't, we may discover it. I'm hoping they will. We did send out, I think Beth, our economic development coordinator, Reynolds, actually sent out, after we heard on Friday, I sent out the new guidance from the state that the governor noted. And I think Ed and Beth were, and Ed, correct me if I'm wrong, they were working together to get that out to the restaurants. I think what we can do is chase down if they're planning on it. I don't know if it was in that email, Ed, do you remember if it was questioned if they're planning it or not?
Yeah, Beth asked, one of the questions that Beth asked was the restaurants, once indoor seating restarted, they also asked the question if they were going to still maintain their outdoor seating too. And it was actually recommended that they do that because we know that there are some people that probably want to go out to eat but don't want to go inside.
But are they required to notify us that they were opening for indoor seating yesterday? No.
There was
so we should assume that everybody everybody is open for indoor seating. So maybe it's time to, you know, between Mark, Tom, and Ed is maybe a revisit, just to check in.
I'm limited due to vacation and personal time, but if Ed or Tom can keep going at it, that would be great.
Tom, if you have, I mean, Ed as well, but if you have availability, since the indoor seating has opened up, maybe to do just some, you know, overviews of the food establishments. And I'm sure Ed, you know, will help, and maybe between the two of you, you can coordinate some efforts to just pay a visit, just to make sure everybody's in good shape.
No problem. Yeah.
And if you think also that sending out an email, I don't know if an email blast with information, things like that. I mean, if you want to work with Laura on that, that would be good as well, just to, again, make sure everybody's in compliance.
So I'm not sure that my question got answered, so I'm going to try it again. We have a Google document that we can access that's sort of a checklist. Is that it, Ed?
So Laura created a Google Doc with the requirements for the outdoor seating. Yeah, I'll send that out to everybody. And then the other document that Mark and I were sharing was a document so that when he went out to make sure that they were following the COVID guidelines, making sure they had the checklist and different things like that. That document literally is just the date and what Mark found. And yes, I will share that with the board in 2 seconds. I'm going to do that as we're talking.
That's
okay.
Great.
Thank you.
So off the top of anybody's head, whoever wants to answer, how many restaurants do we have? How many food establishments do we have in town that you have to check for COVID compliance?
Laura, do you know how many?
We can look at the list.
Laura, do you know how many food establishments we have?
Approximately 80, maybe.
Okay. That's retail and food service, though, right?
Everything.
Yeah, that's CVS, that's the Legion. Well, the Legion doesn't exist anymore, but the VFW, places like that haven't reopened their doors. But we have
that. There's only 3 of those. So let's just say 75 to be fair figures.
Yeah,
so 75 establishments who are allowed to be open.
Schools are closed, so knock 5 out there. You know, so it may come down to 60 to 50 that are open for any consideration. There are some that don't want to do any seating, just takeout. They've been doing okay with takeout.
We still have to check them for COVID.
Yeah, so exactly.
Let me just use the number 50, okay, that we have to go out and check during the COVID time. And this has been going on since March, so maybe April. I'm going to even say May. How many times a month are we touching and visiting these 50 or 60 establishments?
Well, I think our inspection process, Tom Carney, I think our inspections on site were delayed. Normally, I would go out and do my regular rounds beginning in January, which I began to do into February and March. Then this, as we know, began to develop in March, and then the subsequent restrictions and shutdowns. So for a time, we were just kind of concentrating our efforts on emergencies and high-risk facilities, being supermarkets, nursing homes, and when and if we could, do things, virtually, we certainly did that. If it was a need for us to go on site between Mark, myself, and Ed, we certainly did that as well. So I think it's safe to say that the outreach between what's been posted on the town website and Beth Reynolds' assistance, and with Ed and with Mark and myself, I think the restaurants that we have licensed in town are all well informed as to what their responsibilities are, what the restrictions are, what's expected of them. Now I'm trying to kind of catch up with my rounds, and I've been going out there. I'm going to start going out there more aggressively to do my regular routine inspections, and bring these folks up to par if they're not. And if I have concerns, I will raise them and get this board involved.
And if I may, Tom, the COVID-19 inspection checklist, I just looked at it. There's 51 roads, so there's 51 facilities that have been looked into for COVID-19 overview as it relates to their business plan. And then we have a separate list that was created for outdoor seating. So I haven't looked at that to see how many establishments, but I'd say there's probably 10 to 12 on that one.
So I think I could, we're talking about COVID-19, but I know that people can probably sense my frustration from the emails that I was sending around about a food establishment, which we're going to call Pizza Bella, which we're going to call into the next meeting. And I think we all were taken back in the last couple of months. We were doing things a little differently. And I think for me, it's been a long time since it's been a while since we've had to close down an establishment. And I think it's time to get back out there. And I think we should, Tom, if you have any limitations on how many hours you can work, we can discuss that off record. But I think we need to step up the inspections because that was a little concerning to me. And not to anybody here on the meeting's fault, but clearly the establishment's fault. So I just want to make sure that we don't have any other issues out there. So once if you're comfortable getting back out there and doing some inspections, and again, you can work with Mark for the amount of hours, but we would really like to step up the program. I think I can
agree.
I have a general question.
I'm sorry, KJ?
I have a general question.
Okay.
Laura, I think she did tell me that the food establishment permit application forms are all on the computer and easily accessible from outside. Does Tom, Mark, Ed, do you have access to those application forms?
Yeah, I do.
How about Tom?
We send them to Tom if he needs to take a look at an application. Laura and I overview the applications on a yearly basis when they're submitted, usually December, January.
I understand that. The reason that I asked, because recently there was an email floating around with a question for Pizza Bella to tell the owner's name or the contact person's telephone number and everything. So if the data was available to Tom, he could have just picked up the information from that and then gone forward without waiting for a response from the establishment owner. I just want to make sure that they all have.
For Laura could put that. Hold on with KJ. I think an easy solution for that is if Laura, because we're all doing things virtually, if Laura just puts that database in a Google Doc, then Tom can access it whenever he wants it. That might be an easy solution for as well as anybody for that matter.
I know she
did
access it from outside, so I presume everybody can access it if they
I would think we should all have access to that.
Like a contact list?
No, the whole application, because that's when I can review it, because you sent me a copy of it, so I was able to look at it and I did find the phone number. That's when
Laura, to answer your question, I think that would be sufficient. Or, if it's easier just for you to work from one document, you could do the database. We can talk about specifics, at another time.
Okay.
So the reason, KG, that question came up is because, and Ed can probably speak to this, during our recent inspections there, it was kind of convoluted and confusing as to who owned Pizza Bella, who is proclaiming or professing to be the certified manager on site, because the gentleman that applied with the change of ownership said on his application that he was the owner and he was also the certified manager and he would be there over 60 hours a week. And during our recent visits, that wasn't the case. There was a couple there. There was a bit of a language barrier, and there was the certificate on the wall from the gentleman who said that he was going to be there, but each visit he wasn't there. And then when I did get him on the phone to discuss our concerns with him, he was frankly argumentative. He was defiant. He really didn't want to work with us. So that prompted me to contact management through Ed Berman to, and closing a restaurant is something that I take very lightly. It's not something that I do often, but in this scenario, in this case, I feel like, and the emails can speak to that, going back to April, and the site visits between Agent Orm and myself to try to work with these folks. You know, we put our best effort to try to work with this establishment, taking into account the current circumstances with the COVID-19 and the loss of business and everything else, but it just got to the point where it had to come to pass.
I totally agree with you on that one, but I just said that if you have access to it, maybe it's easy for you to look into it and then make decisions easily rather than just trying to make it easier for you, right?
And everyone, I just shared the 2 spreadsheets with the board, so you can see those spreadsheets.
Thank you.
Thank you.
All right. I'm sure Jen wants to get on. Tom, can you hang tight for just 1 minute while we just talk about another agenda item? Just are those your girls in the background talking, by the way?
Yeah, I've been trying to intermittently putting this on mute. So
you don't have to mute. It's a nice distraction. We don't mind at all.
Yeah, they're trying to prompt you.
No problem. All right. We want to talk about the food program in a minute, but I want to just talk because Jen's here. I don't know if she wants to get in on the discussion to talk about the intermunicipal agreement. Ed, are you all set? Are you going to hang tight on the meeting?
I'm going to stay on for now.
Okay. All right. So let's just move. So I'm sure Jen has other things to do. The intermunicipal agreement for the regional nursing. Mark, do you want to give a quick update overview?
Sure. The intermunicipal agreement is with 3 other towns, Framingham, Hudson, and Holliston. I did ask that the MAPC, Municipal Associate Planning Committee there, I asked them to try to get it to us as quick as possible because the plan was to start regional nursing services on July 1st. And I would like to be able to tell Nancy one way or the other if we're going to keep her on until we work this out or for COVID-19 needs. So it would be nice to give her a little heads up. But until we have this in place, Nancy would be our nurse. A couple concerns that come to light is that there's 3 small towns, all close in population. That's Holliston, Hudson, and Ashland. And those 3 towns are paying different amounts the first year based on what they were budgeting the year before. I asked legal counsel to review it and management as well, and the Board of Health will be part of that review, including seeing where we want to go with this. But presently, the majority of the money to start it up, the startup cost will be from a state grant, but that will go away after next year. And as that money goes away, then the town will need to put in more funding for the regional nursing. Legally and by management, I'll let them make a decision how they want to move forward with this, and then it will come to the board for your final review.
So my first thing for the board is, Mark, I don't know if you had a chance to see my email. So you have not heard back from Lisa Mead on this, right?
Diana, I have not
okay.
I can check my email to make sure.
So what my thought was is, I mean, I'd like to go over this just quickly, and maybe we can have a quick meeting specifically for this item. I'd be curious because I had a couple questions on this, and it might be just my interpretation, and I want Lisa to look at it. Sorry, Nancy just joined the meeting. I did have a couple of questions on here, and I wanted to see what Lisa's was, because the same thing, like Mark said, it says the base assessment is different, which it doesn't say there's any adjustment factor or anything. So, and I would like to get Lisa's feedback on this. I think because we have a handshake of an agreement right now, I don't think July 1st is, I think it's a moot issue. Clearly, we know we have the funding for next year. So if we need to, once councils review this, if we need to just get together, virtually and just have a meeting to discuss it and maybe take a quick vote, that might be our next step. Again,
Diane, I'm sorry, Mark, did you send it to Lisa specifically for her review? Because I didn't see that email.
Yes, I did.
She responded back the email. It was not attached to the email because it was a trail.
That is correct, and I sent it back to her with the attachment.
Yep. But I do, one of my things that I noted on here is it says that, there's no page number, but section 7, the district staff shall perform the duties and have the responsibilities listed in their respective job description for each of the municipalities. So I think we all need that before we can make a, I mean, clearly we're moving forward. I think we just need to see that as well. Anybody else have any comments or anything?
Question: do we know what is our yearly share of money that we have to put up?
So it says in the agreement, KG, it's a 3-year agreement. It says the base assessment, and it says what they are. Ours is 10,000, which is what our annual budget amount is.
Right.
Like Mark explained, Holliston is 5,000 and Hudson is 7,800. But when we originally started the meeting, that's what everybody has in their budget currently. So that's where those figures came from. City of Framingham, their portion is 65,640.60.
Okay.
But I just didn't know because it says the base. Does that mean that's the 3 years? It doesn't show anything for the assessment over the period of time.
Okay. And the first year is paid by some grant, is that right?
No, we have the money in our operating budget right now. So we would.
Right. Right. But I thought that Mark was saying that the first year is being paid by some grant. Did you?
The the MAPC grant is going to offset the city of the city of Framingham's expenses. Is that correct, Mark?
That is correct. The city of all of the 3 towns and the city of Framingham for the regionalization startup costs. So there is still the cost of $10,000 this next fiscal year to the town of Ashland.
Right, because the grant is covering the expenses right now, any of the expenses right now, or the startup cost, any equipment, things like that.
Oh, okay. It's only startup cost. Okay, not the functioning cost. All right. So
it will be a functioning regionalized nurse as of July 1st, if that's.
No, he's asking about the grant. The grant doesn't expire June 30th, right?
That is correct. The grant is to get us started through next year. I can check. I was trying to look at the contract to see. I believe the year after, I think it may cover some of it, but it goes on to that down at the base of the contract.
Right,
and
so
we can terminate, but you have to give notice and all that.
Yeah, irrespective, we have to spend $10,000 from our pocket from the Ashland. Is that correct?
That is correct.
Okay. Yeah. So we are not at disadvantage compared to what we have been getting the benefit out of, right?
It will be.
Right now, we're not paying anything.
Right, but we have expending that money by hiring some nurse that we have and paying her for the work that we need done. So you will get the same services for the money that you're going to spend through this system.
I can't answer if we're going to get the same services. I can just say that our effort is to regionalize.
Right.
So
it doesn't seem likely that that's going to happen. If you're telling me that we're 10,000 and the others are, another 12 and Framingham 65, that means I don't see where it's going to benefit us.
So I can tell you from going to the meetings that the whole dollar figure, I think it's misleading because that just happens to be what each town has. So going into this agreement, we knew that, well, our next year's budget is starting. So that's where the figures came from. But my understanding from attending the meetings, it's going to be fair and equitable across the board. The services are the services. But again, with that said, is in here, it mentions each community's job description. So I don't know, Mark, did everybody submit a job description or is there one?
No, we worked as a region setting up a job description for a regional nurse. And we were supposed to also consider a CNA, which is a nurse's assistant.
Do you have that job description?
I don't have it in front of me. I'm looking at right now I have
Jen, did you want to add something?
I just want to ask, so for our other regional, we have a regional crisis management that works with the police department, and that's what several towns, and there is a baseline sort of allocation for time. Was there any discussion on that? So, that's shared, obviously, and if there's an emergency, they would be called out of Ashland on Ashland's day, because you have to go to wherever the crisis is. And that in the same token, if they're in a different town and we needed the crisis therapist, they would come to us, or crisis case manager. Was there any discussion about sort of a baseline of allocation? I think that's to Keiji's point, that you want to make sure you're at least getting what we're currently paying for.
Correct.
I would have to look deeper into it. I believe, Jen, as you said, as it relates to the situation of emergencies, that was the whole concept that, because it came up with COVID-19, well, when we're all in dire straits, what do we do then? And there was some concern about that. So Hudson right now is considering holding on to their COVID-19 nurse. They just hired a full-time COVID-19 nurse over there, and they're considering holding that person on and consider this regional effort. This regional effort will be more non-COVID-19 routine nursing, such as child immunizations, blood pressure clinics. And as you noted, if someone had, say, a hepatitis A concern in a restaurant, for example, and it required, say, 90 patients needed to be reviewed, that nurse would then have to tailor that person's time to that town, and the other towns would not, would lose some of that service in those weeks, basically. That's how it's set up.
But setting aside, I'm sorry. I'm sorry.
Let me ask one more question, if Diane permits me.
Yeah, well, I just want to ask one question before you would go there, Keiji, because I remember sitting at the meetings and we did talk about the allocation of time. And I didn't, was there anything formal put together for that?
Well, in section 7, second paragraph, it says it's the responsibility of the lead municipality, that's Framingham, district staff and board to ensure appropriate and fair use of the district staff so that the time is fairly allocated across the municipalities.
Okay. KJ, what was your question?
The question was, prior to COVID-19, whatever work that is being done for us for the $10,000 that we have allocated in the budget, do we get the same service? If we get it, that's the reason that we went for a regionalization, so that we have availability.
So we would have more service.
COVID-19 is an anomaly that happens once in a while or for a longer period currently. So that needs to be in augmented funds and augmented service. Maybe the regional services will also have an augmented service clause in it to hire more people, spend more money on that.
That's a possibility.
Yeah, and sitting in the meetings, I mean, obviously that was the intention when we first started this, was to get more bang for our buck, so to speak, because we have limited money and we wanted to offer more services, but we have had issues getting more money ourselves. So this was what management wanted us to look into, and that's where we're at right now. So I can tell you that my intention of going through this process and going to these meetings and so forth is, yes, to get more for our money, if you will, because we're going to be offering, I mean, it could be the same thing. I remember talking about this, is that if Holliston's having a clinic, our people could go there and vice versa. So it's going to open up more opportunity for our residents, including every Ashland resident who needs a vaccination, to go to downtown Framingham to a clinic. And that's huge.
Yeah. We've spent a lot of hours on this board over the time that I've been on the board, talking about nursing. In particular, it becomes a big issue when we start talking about the budget and saying, okay, well, we have this much, and we ask Mark, what are we doing? What are we not doing? And when we start talking about immunizations, well, we've only got our nurse for 5 hours or for this amount of time per week, and there's not enough time to do this. And we started talking about requesting additional money in the budget for more hours to the nurse, the potential. We talked about hiring a full-time nurse, and we talked about all the reasons why we couldn't afford to do that. So I think now this is a potentially great thing, or something that is going to blow up and end up being nothing. And so What we need to do now that we have an agreement in place and we have the potential for this is we need to be very careful. We need to go back and really look at what are the services we've not been offering because we don't have someone in the nurse position for enough hours to provide those services. What are the things that we've wanted to do that we've talked about? Whether
And
it
Mark
be,
has that. I know Mark has that.
yeah, we have that. And now we have to start saying, because I think it's important, other than talking about allocation, it's important that there's some documentation on allocation and someone is having some control over how much time we get this nurse. But what's more important is that we have a very clear statement of what we want that nurse to do. So that when the nurse says, okay, I'm here for your time, they're not just sitting in a room waiting for us to tell us what to do, that we have a clear path for them. This is what we want to accomplish. This is what we want to do at that time.
Mark, could you get us the job descriptions from the other communities as well, so we can compile one for us? Or anything up? I mean, I know you have a job description already, right?
Sam, when he went, Kitty Mahoney told me they've already hired someone. So I can look to see what job description, what it looked like when they hired that nurse. I spoke to Kitty about a week ago. And Nancy's here as well, just our nurse presently, and she's listening in. But just so the board knows, some of the things that we were, this all started when Framingham called me in to talk with their new director, Sam Wong, about 2 years ago. And they were saying, you know, Mark, we've been kind to Ashland. We do your childhood immunization, but we can't afford to do it anymore as the city of Framingham. So it created an opportunity to look at other methods, and that's how we got to this point.
Yeah, incidentally, I don't think we have any numbers to work with to find out what our need is. And also, whatever job description that you think that fits on our needs, that's what we need to work with. And then do we have a subset of that job description that fits our needs right now? Other than the COVID issue, leave that alone because that's an anomaly that we cannot
want, right?
That to adulterate this issue, but this may be taken up later on as a regional issue to work
Well,
on the
like
COVID.
I said, I don't think we have all the information to continue the discussion tonight. So I think what we should do is we should ask Mark to draft, because based on Section 7, it says we need to have our own job description. So if Mark works with the other communities and drafts a job description for us, we'll have a meeting. Excuse me, I have something flying in front of me to discuss just this. I mean, because I think
Diane, the reason if we know what our needs are, we should be able to come up with a job description. The other towns may have a different need for it, but we may not go to that need unless we want to learn what other things that we can include. That is a different issue.
Right,
but
and
we should be able to build a job description for our need.
Okay, I know, but KJ, what I'm trying to prevent, because at the last couple of meetings, I sat here and I felt very unprepared to make decisions. I felt that there wasn't enough information in front of me, and I am not comfortable voting on this agreement. We have not gotten town council's approval, and I have not seen a job description. So I'm trying to move this item forward because we're not ready. We're not ready. I mean, if we have a meeting next week or 2 days from now, whatever the case may be, and we feel comfortable, that's fine. But we can sit here and talk about all these things, but I need other information before I can. Definitely. I feel comfortable moving it forward.
Diane, just to piggyback on Chris's point, I think just as far as the time allocation, like you were talking about and Mark was talking about, I mean, it just seems logical. I don't know what the hours are. If it's one person at 40 hours a week and Framingham is paying 75% of the salary, they're going to want 75% of that time. So I'm just saying, if you're going to split 25% of the time between the other three, I don't see how it benefits Framingham at all. It could benefit us, if I didn't realize that we could have our residents actually go to another, at least go to Hudson or, one of those. I knew Framingham, but I figured that those smaller communities really wouldn't have the availability that it's going to be. If Framingham's footing more of the bill, I don't really see where Framingham gets, any use out of us.
My understanding, and Mark he can get that figure probably broken down from us. My understanding from that figure from going to the original meetings is Framingham was going to hire the person and cover the benefits.
Right.
So
Well,
I
read
don't know if that number includes benefits. So it might not be. That might be just the base salary. I'm not too sure. I don't know what I didn't know we hired somebody. I don't know how we can hire somebody if we don't have a job description. So this is where my frustration comes through, because I just heard that we hired somebody, but I'm like, we don't even know what they're going to be doing for us.
Yeah, but in addition to that, Framingham is paying the benefits because they have to pay, whether they hire a full-time or 3/4 or maybe more than half. They may have to pay for it no matter what happens.
They're not charging us back for it, Keiji. That was my point of that.
Correct. So
Judy, did you have a question? I'm sorry, I interrupted you.
I just think that we're talking about something we don't have enough information on. So
okay. So why don't we table this discussion until we get further information, and I will work with Mark, and if we can get get the information. I mean, Framingham knows. I mean, because we were. I mean, even though Framingham's a lead agency, we were one of the lead towns to bring us forward. So I mean, clearly they know we're.
I'm for it, and if you need to have an emergency meeting for this to resolve, I'm okay with it.
Okay.
Diane, we may want to invite either Kitty Mahoney or Sam to be at the meeting, because they did tell me, Kitty told me a week ago that they already hired the nurse. So
Mark, I have faith in you that you can handle the conversation.
well, I need to know what. Tell you the truth, I was kind of shocked too when I heard that. I said, "You already hired a nurse?"
Well, have you been going to the meetings?
There haven't been many. They've been by Zoom, so there was one or two, and I did suggest that they consider language for urgencies of like COVID-19. So they did add a clause.
Okay.
Mark, muted yourself.
That's okay. All right. So why don't I work with Mark to get some more information, and we'll just table this discussion and pick it up where we left off.
So moved.
Okay. All right. Let's see.
Just for clarification, the towns were Framingham, Ashland, Hudson, and Holliston?
That is correct, Chris. And I did, if anyone had any additional questions on present duties, Nancy is here, and I don't want to keep here too long, Nancy, and I want to thank Nancy for all she's done. She went from 5 hours to over 40 hours to help us with the COVID. Between Nancy and Ed, it could have never been done. So I want to thank
you,
both.
Nancy.
Thank you.
Thank you.
I mean, I don't think there's that question. I think everybody knows you both are working, or all are working very hard on it. So, I'm just looking. All right. So the next item on the agenda is, Jen, do you want to stick around for the next item? We're going to talk about a new restaurant program. I didn't know if you wanted to add anything, or.
I will probably listen.
Okay. All right. I didn't know if you were waiting to get off, so that's fine.
Appreciate it.
Okay.
She likes our meeting.
I'm sorry, KJ?
She likes our meeting.
Yeah. Look at she looks tan and in a tank top.
It's because she has nothing to do.
And Nancy, you're more than welcome to stay on, but we're going to talk about a couple other things. So I am excited about this one, I think. So the next item on the agenda is, I know Judy had mentioned at the last meeting about a rating system for restaurants and food establishments.
Right.
And it looked like to me, between Mark and Ed, collective efforts, that we found a food establishment program that will take care of food establishment reports, rating system, and COVID-19 tracking. Ed, do you want to?
You just took the wind right out of my sails, Diane.
I'm sorry, Judy.
What are you doing?
I'm excited. Judy, why don't you go first?
Well, if you visit LA, you walk around, and on the front of every restaurant is a white piece of paper, 8.5 by 11, and it has a giant A, B, C, D, or, well, there wouldn't be an F. And basically, that's the rating that they got from the Board of Health. So why would you go anywhere except an A restaurant? It made so much sense to me, and I didn't understand why, we couldn't do it around here. So Ed, who I've got to say, you're just so professional and proactive on so many levels. I've been so impressed in just short time that you've come over to help us, including on, let me just mention, the vaccinations, and setting that up right now, being so proactive. But let me go back to the ratings. So you had a conversation, Ed had a conversation with Tom, if Tom's still on, during the Pizza Bella incident. And he mentioned a software that he really likes. So Ed, being Ed and being proactive, went and pulled the string a lot further and found that this software not only did a lot of great things for Board of Health, and I think Mark is familiar with the program, but also that it can help with our rating, and it can automatically do it based on criteria. And I'm going to turn this over to Ed. I'm excited to do that. And there you go, Diane.
Yeah, so when I was with Tom that Saturday, all of a sudden Tom flipped open his laptop and he starts punching stuff in on a program, and I'm like, what's that? And he tells me it's the program that he currently uses for Ashland and for the city of Boston.
Just Ashland, Ed.
I'm sorry?
Just Ashland for the win-win.
Oh,
Yes.
just, okay, sorry. Yep. So I asked Tom, I said, well, is it good? And he kind of gave me a look, and I'm like, well, what do you recommend? And he said, well, I recommend this software called Food Code Pro. I'm like, okay. Monday morning, I contacted the, Tom actually gave me the number of the woman that owns the company, and she went through the software with me. And one of my big questions was, well, can we do our COVID checklists? That was my first question I had asked this woman at Food Code Pro. And she said, well, that's interesting that you say that. She says, because we are allowing cities and towns to set up a free account on our website, and you can actually do an entire COVID inspection free of charge, and it saves it. You can print it off in PDF, email it. And I thought that was great. So that's something that we could actually start using tomorrow with the board's approval, obviously. But then I asked her more questions about her software. And again, this is a software that Tom thinks is really well done. And the software has some really unique, great features. One thing that I really liked was that whenever the FDA or the Commonwealth updates anything in the food code, the software is automatically updated. And then it also has a rating system. And I would encourage the board, I actually showed it to Judy, I would encourage the board to go to the town of Uxbridge's website because they use this software and they use the rating system. And you'll see they have a restaurant there that when they first went out, scored a 55. And then if you look at their next report, when the board helped them and the food inspector helped the restaurant, they were allowed to reopen and they got a 77. And then they re-inspected them 30 days later and they got a 98. The software, and then again, you've got your rating system already built into the software.
And everybody wants to comply because everybody wants an A.
Right. Yeah. So then, as I'm talking more and more, I found out that there was a grant available. So last Thursday, I had Mark work on securing the grant for the town, and what the grant will cover, which obviously, if the board approves and we decide to go this route, it will pay for the first year of service, and it includes 2 brand new tablets. If we don't like the software after the year, we walk away. That's it.
It's our data.
There's nothing to lose. The cost of the software after the first year is $1,800 per user. So it would be $3,600, one license for Tom, one for Mark. And again, right now with the current software that the town had purchased a few years ago, we pay an $850 annual maintenance fee. This software is the $3,600 a year, but that includes all the updates, training, and use of the software. So there is no additional maintenance cost. So yeah, it's going to be a little bit more, I did look around. There are some other softwares out there. Some are much cheaper, but just don't do what this software does. And I just kind of want to open it up to Tom now because he's got experience with this and this is what he does. And I want to get his feedback too.
Thank you, Ed.
Thank you, Ed, for reaching back out. And it's important to know we've had discussions with this vendor before. Myself and Mark, we had other vendors that we cross-compared this to. Initially, when they approached us a couple of years ago, the price was exponentially higher than what's available now. I think now it's advantageous to take advantage because of the grant and how it's evolved over time. And I know that Mark has known Lisa Berger, the owner of this company for many years. And I know he can speak to how good she is as a food safety consultant, and her experience, years of experience, has enabled her to secure food safety contracts with the Boston Garden, Gillette Stadium. So she's developed this software based on, boots on the ground field experience. And it's also adaptable to have abridged inspection forms for different scenarios. So like currently, when I do an inspection at the farmer's market, I have to go through a plethora of a checklist of items that really have nothing to do or would never come up at a farmer's market, like floors, walls, and ceilings, and mechanical refrigeration, and all these other things. So it would be nice to be able to have something that's more user-friendly in the sense that we could develop like more abridged and condensed checklists depending on whether it's a temporary food event, which we do a lot of, or the farmer's market, as opposed to what we do at a restaurant. The grading piece of it is certainly appealing if it's applied properly. One of the cons to the grading that I've dealt with in other municipalities is sometimes operators, they kind of lose sight of day-to-day responsibilities and food safety applications, and they just hone in on just getting that grade and being reactive rather than proactive. And it can be a monetized system. I don't know, depending on how you want to do it. There's most municipalities, there's a fee structure involved. So when I conduct a routine inspection, I tell you when I'm going to come back in most cases. So I will conduct the inspection. I'll tell you what the issues are. I'll tell you when I'm going to come back. So shame on you if when I come back, you don't correct the issues on the report. That's what's going to negatively affect your grade. And typically, and I know New York City does it with a more aggressive fee structure, typically if you come back for that follow-up visit and there's outstanding critical or foodborne illness risk factor violations, you're going to be penalized in your letter grade, and it's going to drop to a B or a C. And thereafter, usually there's some sort of fee involved for another inspection for the inspector to come back, so you can pretty much buy yourself an A letter grade. So there's pros and cons to it. Yeah, it definitely is effective as far as a visual thing to the public to see that grade in the window. But again, dealing with it in other job, my full-time job, you'll find people that it's hard to monitor. You'll find people who do get a negative grade, they won't post it. They'll post it in a hidden area. They won't listen to what the qualification, so it can turn into an issue where people don't post it.
Well, that's can I just say one more thing? That's why I thought it was so unique about Uxbridge, just having their inspection reports right online for the public to see. I thought that was great.
And they're not doing, they're like, and I think you said it was LA, Judy, but they're, Uxbridge, I checked it out as well, as they have the inspection reports. It's very easy to read, clearly distinguished violations, and then it's each inspection report that's graded. That's what I like.
Right.
So if you went today and you gave Isabella, clearly is on my mind, an inspection and they failed it, and then you go back, in 3 days and they pass it, obviously they want to get that higher score. So I don't know, posting a number on the door is what Judy was anticipating, but each inspection report will actually have a grade on it. And that's what Uxbridge has. And it definitely makes you look at it,
I think there's probably another component to this that might make sense. I'm thinking out loud, depending on Tom and Mark's expertise in particular here, is if you have a restaurant, say, that is consistently getting A's, you might say, well, you know what, I don't have to expect them, and I'm using make-up numbers. I don't necessarily have to inspect them every month. I can extend that out to maybe a second month or a month and a half, and you can focus more time on the restaurants that maybe are in the C range or D range and stuff like that. It might be a tool in which you can balance the amount of time to inspect more frequently the restaurants that need more inspection and more attention to detail.
And that's a good point, Chris. And the other point to that, Chris, is if they need additional inspections, additional fee.
I'm assuming there's also probably reports, because I know, most of us like the data. We should be able to run reports on this. Okay, are we getting these 5 establishments getting, a below average grade because they need CFMs or they need training for, I think that we might be able to look at the data and figure out what training and things that we might offer them to help them. I'm assuming it sounds like a pretty good program.
I think we could also, if we do go ahead with this software or something very similar to it, I liked the aspect that not only did they have the COVID forms already set in, but they also, anytime the FDA or anybody or the state had a new rule, it would automatically be programmed into the software, was my understanding. So I love the cons that you gave, Tom, because those are things I didn't think about. I definitely think we need to make some change and have, full documentation of this rather than not have a place where everybody who lives here and eats in these establishments can go and get the information that they want to make a good decision about. I love Uxbridge's that in the report, not only do you have text, but next to it is a photo of exactly what they're talking about, whether it's a backed up sink or whether it's a, bad electrical system or whatever the problem is. And then everybody, knows why that person got that grade. It wasn't anything that was, whatever the word is, at whim.
I also, just one more thing, I did speak with the food inspector in Uxbridge, and I asked her before they implemented this in January, they actually did an outreach to all their restaurants and explained to them what they were going to be doing.
Okay.
And so, just, hey, this is what we're doing, and, pretty much get ready, and we're available for questions if you need help.
Right.
So is everybody comfortable with moving forward with this program?
I am, but I have one question though. Why do we have to have 2 licenses? Today, Tom is working for us, and tomorrow, if he doesn't decide to work for us, then we lose the license. Is it given to the Ashland or given to the individual person?
No, we would transfer the license to a new person.
Why do we need 2? Because
Mark needs
most of the inspections are done by Tom.
But Mark needs one also.
What for?
Each user has to have a license.
It's a per user license system.
Tom is visiting anywhere in the town, and then he can present whatever data he needs. He can get it for Mark.
So is Tom the only one doing food inspections?
Most of the inspections are Tom. Yes.
Mark, do you do food inspections?
Yes, Judy, I do.
Okay, so you use the WIM. What is it? WIM? What is it?
Right now, because of the computer situation, I'm using paper, but I prefer to have us all in the same electronic program so we can compare. Tom can pick up a report from me right on the same electronic program. Very important to have us both on the same program.
Okay,
so hold on, Mark. I thought we had a grant for an iPad Pro. Oh, Mark, you muted. Sorry.
No,
Sorry.
no. The iPad doesn't work. iPad doesn't work with WinWham.
Oh.
Yeah, that WinWham unfortunately doesn't have the features I was hoping to see, and it does. That's why Tom and I have been looking into this for 2 years, and actually it was too cost prohibitive, and that's why I thank the board for increasing the revolving fund to the 45,000 for next year. But at the same time, Food Code Pro came down, which is relevant. That's the name of the company. So a lot of good has happened through the process. We did evaluate other companies, but it would be advisable to have 2 people on. So if Tom's out, I can pick up his report electronically and go right from that report versus trying to download it and so forth into another program. With that said, I think it's a great opportunity for us. It's going to save time in the inspection process. The only disadvantage, I went to a conference in Food Code Pro was there, Lisa Berger, and she showed how convenient it is to use your iPhone. Well, talking to the owner of one of the owners of the company when I went for the grant last week, he said, unfortunately, she shouldn't have been showing that because that app has not been created. So that's why they're going to give us the iPads. But still,
you both would be getting one, correct? There's 2, so you would have one and Tom would have one. So
we have one in town, but that is correct. And I told him down the road we may only need to buy one more if they're not going to loan them after next year.
Okay.
Can I just understand one thing, please? So we have 2 licenses right now, but only one person is using it. Because Mark, you couldn't use it because it didn't go with your iPad, but did you ask the board to get you anything else so that you could use it?
Well, right now there's the opportunity to.
Do you feed your manual inspections into it?
Yeah, I've tried using WinWham. Takes too long. I can do a better job by just going to paper. Ask Tom. WinWham, you have to populate every single point.
Yeah.
Where's all the paper reports?
Sorry, I couldn't hear you.
Where are all the paper reports that you do?
They get filed, and that's a disadvantage.
Do they get put in the system though?
Well, they're usually like temporary events and so forth, or if it's say no water. We had that issue. I might end up doing 25 facilities in 6 hours. No power. That happened last November. So those forms get populated just as a one report because we go in, we got 5 minutes, we leave, we go to the next place. So
but if you do a farmer's market inspection, does that go into WinWham?
That actually didn't. Tom's picked that up since he's been with us. Prior to that, it was paper, and it was combined, like Ashland Day was combined, because it takes too long to populate reports. So this will allow us to populate electronically and have them not just readily available. I think it's the way we need to go at this point.
I just pause for 1 second. Hold up. I just need to get this off my head because so if I'm concentrating on the farmer's market. So if the farmer's market, there's 3 different vendors, there's 1 report? I'm confused.
No, there'd be 3 reports.
Okay, but they're not in WinWham.
No, they're not. Well, they are. When Tom started, they got to WinWham. Yes, they are in WinWham.
Yeah,
now.
I enter them into WinWham. I usually conduct on-site inspections. I make notes of them, and then I enter the inspection later, and then send it to the vendor.
Okay, so you go into WinWham, Tom, and you put this report in. Do you generate any reports from that to give to Mark or the board or anything? I'm new, so I'm just asking.
No, yes, I do. I generate the report, and I save it as a PDF. I put it into an email, and then I send it to Laura and Mark. And then Laura puts it, I believe, into a share drive that board members should have access to.
It's actually in the it's on a
Google Doc, right?
Is it a Google Doc? No, it's not a Google Doc.
It's on a Dropbox, isn't it?
No, it's just a regular file, like a shared file. But yeah, I think you guys could have access to it.
I can address that. It's on a shared drive at the town, but yes, we can move that to a Google Drive folder. What happens is once the reports are generated, they're generated as PDFs.
So there's a lot of reports that Keiji has been asking for, and I'm wondering if some of the data is in this WIMWAM that you could get, Keiji. It'd be interesting to know what kind of reports are able to be generated.
Yeah, some of them they can, and I think Tom did some of them, but I am still looking for some more. So I will probably correspond with him and Mark, and then get those things soon.
Great.
And
So what's our action now? What's the intent?
Can I just say one more thing? Also, with this, if we go with this new software, after an inspection is done, a copy can automatically be emailed to the board, automatically through the. So you'll just see the report instantaneously as soon as it's done. So I think the next steps, it would be, so Mark got the contract for the grant that came by email. I think to be safe, the next best step would probably to have Lisa Mead review the contract to make sure we can get out if we want, just cover our butt.
Somebody like to make a motion?
I think you need to go in and negotiate with that person to tell them that more towns will take it if you sell it at a lower rate. So you should negotiate with that.
I make a motion.
You're good at it, so you should be able to get it done.
That upon approval from town attorney, town council, that we go forward with this software and get 2 licenses and training for 2 people, and that we get going on it ASAP.
I second that motion.
Any further discussion? All in favor?
Aye.
Aye,
Keiji.
Aye, Diane.
Aye, Judy.
Yay. I'm
And
excited.
it's important. Thank you very much. And it's important to note too, I forgot to mention that with the current WinWAM, when I enter inspections on my Microsoft Surface, they stay on my Surface until I'm able to get back to Town Hall and sync it up to another laptop that we have, in order for there to be accessibility to those reports at the office. But although I do email the PDF, so
okay,
everybody has access to them. It's very antiquated. I'm saying
all the current reports, will they merge with the new one, or will they be imported, exported? No.
No, but we can put them on the shared drive and get them to you guys. One thing I do want to encourage the board to do also in the meantime, if you please just go to their website. In the upper right-hand corner, you'll see COVID-19. Sign up for a free account, and you can see how easy it's going to be for us on the free side to do that COVID-19 inspections and have them all documented.
This is wonderful.
So I want to jump in for a second if I can.
Yeah. Sure.
Just to share my experiences from being part of an IT department, and how we need to do some forward thinking now, right? So this is fantastic from a practical perspective. So if the iPad though is going to be the tool, the primary tool that is going to be used, iPads have a lifespan, right? So an iPad in this environment, I'll be very generous and say you might get 2 years out of it, okay? So you have to think about defraying the cost over a period of 2 years. That means 2 years from the start, we're gonna have to invest in 2 new iPads. So how much does that cost? And we got to get it into the budget and start thinking about that now. Now,
is this compatible, excuse me, with the Microsoft Surface? Do you know, Ed?
So I did talk with them. So each user can have the software on as many devices as they want. So if you've got your own tablet, you've got a Microsoft Surface, yes, it's compatible. Like I've got an HP EliteBook. Yes, you can use it on the HP EliteBook. Each user can have it download as many licenses as they want for their own use. And also I want to let the board know that I also sent all this information to Paul Carpenter, our IT director, and
awesome.
He is on board because he is and Paul loves cloud type services. And Paul said he's on board 100%.
It's fantastic because there's no overhead on his end.
Correct.
Ed, the other question is, does this also serve us to get the applications done, food permit applications?
I didn't ask that question, KG, so I'm not sure.
If that can be done and if people can.
I did ask that question, if I can offer some notes to that. According to the owner of Food Code Pro, he said that he would have to work with the people that are handling our present permits. Our present permits are not electronic yet. We're trying to get them in the same program as our building permits. And he said he could work with that company. So they are working with other companies that do application process. And hopefully we'll be there as well, so we can do our permits electronically.
All right, I know I usually stick to my 8 o'clock deadline. I know we're going to be maybe a few minutes over, but I've been sitting here for 2 hours. I don't know about anybody else.
I'm hungry too.
A little much in my little office. So, I mean, if we're all set with that, I mean, I'm sure next meeting, whenever it will be, we'll get another update on it, and we'll leave it on the agenda.
Yeah, so Mark, tomorrow, if you can just get that stuff to Lisa Mead to review. You're muted, Mark.
Yep, Mark, you're muted.
Tom, go get the
Jen, if Jen's with us, they do have it, the information. So, and Ed, you've helped out with the explanation. So I could.
She left the meeting.
Oh,
Janet.
I can just ask by email.
There she is.
Oh,
No,
there.
But Mark, send it. Don't. Lisa might get in with the whole trail of an email. Just send her one document, just because, you know.
Sure. Is that okay, Jen? Send this to Lisa.
Yeah. Is it just the contract? Is it just it's their contract?
Yeah,
And
it's
the grant
contract. Yes.
Yeah. I mean, Lisa's probably gonna want us to use our contract that we typically use, but she can certainly look at it. That's fine.
Okay, thank you, Jen.
Yay.
Yay. All right, Mark, moving along, budget update for 20. I know you provided us with a budget report.
You're muted again, Mark.
Thank you. I take it off and I keep forgetting Chris. Thank you, Chris. Anyways, you'll see the budget in front of you. There is a exceedance in payroll, so I have an email off to our payroll administrator to find out where that money is. There was $4,000 that showed up this month, so it's interesting. I don't know if it's mixed in with COVID needs, or we'll find out. I have Kathy Arsenal sent a notice to her to find out.
Mark, do you think that's a COLA?
If it is, I didn't know I got that much of a COLA. It's a nice COLA if it is, but I don't think it is. I think there's something's going on there that we have to dig into. Outside of that, we're all within reasonable tolerance of the budget needs.
Awesome. All right, moving right along. Update on the intern? Meredith Daly indicated that she has found 2 other communities to intern in, so she no longer will take the offer from Ashland. Okay. That's unfortunate. Next item on the agenda is, well, actually, before I move on, well, I'll move on. Did everybody get a chance to review the May 19th meeting minutes?
No,
I did not.
I did not either, and I apologize.
I did not.
Laura, can we just move that to the next meeting?
Yep, no problem.
And also the Isabella is going to be next meeting, right?
I didn't hear that. What, KJ?
Isabella is going to be on the next meeting. Is that right?
Pizza Bella's, yes.
Because I haven't Tom sent a ton of messages and information between 3 o'clock and now. I haven't read any of them.
Okay, and that is probably partially due to me because I was asking a lot of questions because I'm very concerned about what happened there.
I didn't read your questions either.
So I just have a quick question, end of meeting stuff. Mark, you said vacation and time's coming up and we need a nurse, detailed requirements for the nurse job. Sorry, I'm tired. Are you going to be able to work it? I don't know what your timeline is. So
yeah, this vacation won't be that I'll be away from the phone. So if need be, but I believe I'm going to send an email to Sam Wong tonight saying, have you already hired the nurse? I believe they did, according to Kitty Mahoney, who's the nurse for Framingham. So
Right.
I should be able to do that tonight. I was planning to send an email to Sam. I'll send one also to Lisa Mead for the relevant. So I'm going to do a little sending out emails tonight as well.
Okay.
I'm not sure that we want to have another community at our next meeting to talk about the agreement. So I just don't extend an invitation for meeting. I mean, basically what we're looking, you need to write a job description for us.
Well, it's said in the contract that the board would write. That board is the actual board of the region, not the Board of Health.
Okay, that's good clarification. So
it says right, the responsibilities listed in their respective job descriptions for each of the municipalities.
But if the board of the region has to write it, how can they hire ahead of time?
Yeah, I agree. That's why I want to ask Sam.
I think it's us who need to write down our needs.
Well, we missed a step somewhere then, because if they have a job description and they've hired an employee, they would sign this July 1st. We missed something.
Yeah.
So it's section 7, Mark, is, and I highlighted it because the same thing I said, maybe I missed an email because I was away. So,
that's okay. It could be that I'm confused with it too, because I thought they were talking about the board that is created through this agreement. So I can.
It may be. It's just I didn't.
But
so we get clarification, and I think just let Sam know that we've reviewed it clearly. Clearly, we want to, move forward with it, but we have some other things that we need to take care of. So, I mean, it might not be for July 1st, but hopefully shortly thereafter.
Yeah. Okay.
All right. I know even tonight, I know we had the tobacco violations from March, but for topics for future meetings, I think we should move forward with the Mary Mortensen Public Health Award. We don't really know when we're going to be all sitting around a table. It's up for discussion, but I'm thinking that we could do what we're doing now.
Okay. Yeah, but let's avoid getting this Google Meet is no good. Let's see whether it can get Zoom forever.
Yeah.
So go ahead, Diane, you first.
I agree with you. The only thing I'm concerned about is that we put a name on a plaque. So I think what we could do is, because I know in the past we've had people think the plaque was for them to take home, right, Laura? So maybe we could put the plaque there and have a picture and present it, so to speak, virtually. I don't want to keep putting it off because I think it's going to lose its momentum, if you know what I mean.
Correct.
Chris, what were you going to say?
You can do a Zoom presentation.
It was basically what you were going for. I was trying to remember in the past what the recipient received. I know that there was the plaque which they don't take home. That's something that we keep. But in the past, didn't we provide a gift as well?
There's a proclamation
Okay.
that I was going to ask if anybody would like to volunteer. I could send you an example of what we used last year and the previous years. If somebody wants to, I can do it, or if somebody else wants to take a stab at it. If it talks about what they've done, for the town, and
I think you have done a good job, Laura. I don't see why. I mean, if you run into any problems, I guess you could probably reach out. We can help you with it.
Laura, if your time is, if you're busy with other town stuff, I'd be happy to help you with that.
I was going to ask you, Chris. That would be nice.
I'd be happy if you can send me a template. I would be happy to take that off your plate.
Thank you, Chris.
You're welcome.
So in general, we have the plaque, and we give them, I think, Laura, we've given them flowers or something. So again, that, something that we can arrange. Right. So, So again, I'm just thinking, we'll check the schedule. We can, if everybody has their calendars, we can look at the, just the dates for the next meeting.
I got July 7th and then the 21st.
That's what I have. So Laura, if they're available on the 7th, if not, if they need the 21st, that's fine. If they can't make it to the next meeting, virtually, that's fine as well.
Right.
But we'll do Pizza Bella. We'll put the restaurant program on,
Yep.
the meeting minutes.
Yep.
We need to put a reorganization on July 7th, right?
Correct. Thank you,
All
KG.
right.
Reorganization. And the IMA with the city
Yeah.
of Framingham. Yeah.
And Donna Walsh to be nominated.
Oh, yeah.
Yeah, we'll do the reorganization first. As long as it's a full, everybody will be here as long as it's a full board.
Okay.
Why is Donna what's this thing getting postponed? I thought they will be done by April end.
Yeah, I know. She signed it and it's notarized. I think the board just needs to approve it.
I think we just need to take a vote on it, right?
Yes.
I know, even though we're not, by law, we are not, but we are okay.
Diane, do you have anything further for me?
Nope, Tom, you're all set. Go take care of those girls.
Yeah. Oh, I thought you
Thanks,
already did.
everybody. Have a good night.
Thank
Good
you.
night.
Thank you, Tom, for all your work.
Yeah, good job, Tom. Have a good night. Thank you for
You
everything.
too.
Tom
Thank
and
you.
Ed stuck it out till the end with our, thank you.
All
Thank
right,
you, Ed.
if everybody's all set, we'll take a motion to adjourn.
So
So
moved.
moved.
Second,
I second that.
all in favor?
Aye.
Hi,
Hi,
Chris.
KG.
Aye, Diane, 8:05 p.m.
All right.
Good night, everyone.
Please stay
Good night,
safe,
everyone.
everybody.
Good night.
Good
Let
night.
me get out of here now.